Assalamu alaikum. The winds have become dry and dusty, and the number of respiratory illnesses such as the common cold and flu have started trickling in and are rising day by day. So this is what we are going to discuss today, that what causes the common cold and the flu? Is there any difference between the two? How does it spread? What are the symptoms? What are the complications that can come along? Who is more at risk? And what do you need to do about it? And what can you do at your own at home about it? So, the common cold and flu, they are both the minor kinds of respiratory illnesses that affect the nose and the mouth, and sometimes the lungs in case of the flu. The common cold is caused by more than 200 kinds of viruses, and out of these the commonest one is the rhinovirus. 10 to 50% of the cases are due to this, and the rest due to the other viruses. Whereas flu also causes similar symptoms, but the symptoms are more intense, they are more worse, and this is caused by the influenza viruses. It spreads by direct contact from one person to another. If you come across the different secretions from the nose, from the mouth, from the throat, the droplets that are coming out when one sneezes and one coughs, and from the fecal secretions, it can all be transmitted to the others. Then, whenever there is these droplets, when one sneezes and coughs, the droplets spread around in an area of 1 meter, and they can infect the ones in close proximity. And if the ventilation is not good in the room, then they can remain suspended in the air for many hours and keep on infecting the people. Then when we touch our nose and mouth, or if we have sneezed into our hands, and we touch these hands to other places, the chairs, the tables, copies, books, whatever, then these viruses are transferred there, and from there they can reach the other person. So what are the symptoms? First of all, we start from the head. The head starts feeling heavy. There may be headache. There may be mild fever in case of the common cold, and fever more than 100.4 in case of flu. Eyes will be watering. Then there will be stuffiness in the nose. The nose might be runny, or they might be sneezing. Sneezing is more in the common cold, and stuffiness is more in flu. Then, due to this sinus congestion, due to this nasal congestion, there may be pain in the ears. Then, there will be a scratchy feeling in the throat. You will feel that the nasal secretions are going down the back of your throat, and you have to swallow them again and again. A tasteless fluid is coming in your mouth, and there will be irritation. There will be soreness in the throat. There will be scratchy, tickly sensation. Then due to the passage of these secretions, as it goes down, the cough can occur, a dry, hacking kind of cough, which will irritate you even more. Then there will be fever, which will be mild in case of common cold, and it will be more severe in case of flu. There will be severe body aches, there will be lethargy, there will be fatigue, there will be lack of energy. All these lead to either common cold or influenza. Now the symptoms are so similar that clinically it is not possible to see if it is a common cold that we have or if it is influenza, and we need specific type of tests to differentiate the viruses causing them. But the remedies will still be the same. When there is nasal congestion, you will be given, first of all, anti-allergies. You have to contact the doctor. The doctor is going to look at you and they are going to advise you what exactly do you need. To decrease these secretions, there will be anti-allergic medicines given to you. Then to make breathing easy, the nasal decongestants can be given. The saline sprays can be given, especially to the children, so that their airway is clear and they can breathe easily and they can eat easily. Then to soothe the throat, there will be soothers, the lozenges, the strepsils. These can all be given. The salt water gargles can be done so that the soreness of the throat can be controlled. Then if there is stuffiness in the sinuses, you may want to take steam, and you might put menthol in it, you might put Vicks, and heat some water in a pan and then cover your face and nose with a towel around you, and then you breathe deeply from that steam. This will open up your sinuses, open up your blocked nose. Then if you are having fever, if you are having pain, then the different kinds of Panadols, Constans, Tylenols, they can all be given. If there is a cough, then you might require a cough syrup. To boost your immunity, you might be given vitamin supplements with zinc. Now, what you can do on your own to help improve yourself? First of all, take plenty of rest so that it can build up your immunity and you will be able to fight with the disease, because this is a viral illness. It really drains you. Then keep yourself hydrated, because whenever there is a fight going on, it is just like a workout your body is going through, and there will be need for plenty of fluids to keep you energetic and keep your nasal secretions also thin so that they can drain easily. They don't stick to your throat and to the insides of your nose. Then you can take a warm bath. It is going to loosen up all these jammed secretions. Then take hot liquids. You can take lemon with honey in warm water. You can take the clear broths. You can take the soups. You can just take warm milk. So all these hot liquids will be very good for you. Then take green leafy vegetables, and take your eggs and meat also, so that you have enough vitamins in the body to fight against the infection also, and to lessen the period of recovery. Normally the vitamin C's with zinc and other minerals, these are helping you to get better quickly. They will not make you not have the disease, but they will speeden up your recovery period. Then you have to take care that when you are sneezing, when you are coughing, you cover your nose and mouth, or you cough into your, or sneeze into the in your elbow, so that these secretions don't spread around in the room. Use tissue papers, and then these tissue papers have to be put in the cellophans, and they have to be thrown away. Don't let them lie around loose. In the same way, if there is watering from the eyes, just clean your eyes with the tissue paper and again dispose it in the same way. So taking care of these little things can help you get well very quickly. But this goes on annually. The incidence increases more during these months. From October of 2022 up till May 26, 2023, already 19,000 to 58,000 deaths have been reported just related to this common cold and flu. Why? Because certain age groups are more at risk. So who are the people more at risk who have to take more care? They are the ones, the little kids who are under 5 years of age, and especially more if they are under 2 years of age. Then the elderly who are above 65 years, they are very prone to these flu and common colds. And they make up about 70% of the people who are suffering with it and who can die of complications. Then those children who are less than 18 years, but due to some problem they are taking their aspirins regularly or their salicylates regularly, they are more at risk. Then pregnant women are more at risk. Then those whose immunity system is compromised, like the ones suffering with certain kinds of cancers, like the ones suffering with HIV and AIDS, or the ones who are on continuous steroid therapy, they are more at risk. Then if you have got asthma, you are more at risk. If you have other lung diseases such as the COPDs, the chronic obstructive pulmonary diseases, or emphysema, or you have some kind of heart problems, they are more at risk, because all this jamming, all this stuffiness of the respiratory sinuses is going to decrease the oxygen level in the blood, and it is going to put more pressure on the heart. So the heart, people who are already suffering, can get more affected and can get more complications. Then those who are having metabolic disorders, they are more at risk. The ones with kidney problems, liver problems, they are more at risk. Then the ones with neurological problems or neurodevelopmental problems, such as the ones suffering with epilepsy, seizures, or cerebral palsy, they are more at risk. Then the ones who are into endocrine disorders, such as those having diabetes mellitus, they are more at risk. And simply the people who are obese, whose BMI is more than 40, they are also more at risk. So if you fall anywhere in this risk category, don't take your symptoms lightly. Consult the doctor at the right time and take your treatments. And for these people who are at high risk, the annual vaccination of flu is very important to keep them safe. These are viruses, they are very, very intelligent and they keep on changing themselves. That is why a new flu vaccine has to be made every year and the dose has to be renewed every year. So the high risk people, please take your vaccines. Now, what are the complications that can come across? Normally, this comes and goes on its time and you just need the supportive treatment that we have mentioned. But at times, these complications occur mostly with flu. What are they? They can cause sinus congestion with added bacterial infection causing sinusitis. Then they can cause middle ear infection. Then these can cause throat infections, chronic bronchitis. If they go down into the lower sacs, air sacs, and pus develops in them due to added bacterial infection, there is solidification of the lungs, that is pneumonia can occur. Then if it goes and infects the heart muscle, then myocarditis can occur. Then in cases of the flu, it can cause just dehydration because of all the work that is going on inside the body to fight these viruses. Then sometimes the flu virus, it can enter the brain tissue and cause inflammation of the brain tissue, which is called encephalitis. So all these complications can occur. So if you think that taking the home remedies is not helping you and the fever is persistently there, it is increasing, your cough is increasing, your headache is increasing, please consult the doctor. So please take care of these little things and stay very safe and away from the common colds and flus. Assalamu alaikum. Allah Hafiz.